A very good evening and Merry Christmas. This evening we'll be looking at a very interesting topic on primary health care. The topic is community mobilization. What is community mobilization? Why is it very necessary to participate in community mobilization in a primary healthcare setting? Community mobilization is defined as a means of encouraging, influencing, and arousing the interest of people to make them actively involved in finding solutions to some of their own problems. For example, reproductive health problems, mental health problems. For you to make community mobilization successful, you have to encourage and influence the people to have interest in the aspect that you are involved in mobilization. You cannot mobilize without influencing their opinion about your interests or about the community health interests in the society. The effectiveness of healthcare service in a community will depend on the extent to which the service is relevant to the economy, socio-cultural, and health needs of such community. It also depends on the extent to which the community has been actively involved in assessing their health situation, defining the problem, planning, prioritizing, implementing activities, implementing and evaluating their programs. It is not possible that individual families and community can be made healthy against their will. They need to be mobilized to participate actively in their health development. For instance, when you find out in a community that people there is a health need, or the people in that community are having some nutritional problem like kwashiorkor, is a thing of concern. Some may be having resources within their reach. Within the community, they may be having the resources to solve this health need of kwashiorkor, or family health problem need in the community. When the people are having reproductive challenges, or they have many children, more than they can cater for, you have to educate the people in the community about how to engage in child spacing. Make them see the need so that they can utilize the few resources. Child spacing is of high benefit to the people of the society. Advocacy and strategies for effective community mobilization for healthcare. The community involvement cannot be dictated to the people. You don't dictate to them what to do. People should be in a systematic way made to see the need to be involved in the affairs of their health. You have to engage them in discussion. You have to engage and explain to them what they need to know about their health, what they need to know about how to solve the problem that is affecting their health. A clear national policy is needed to encourage community collusion in health promotion efforts. So also a national commitment to support community involvement. The national commitment include engaging communities in programs that will help to eradicate outbreak of disease. The people should be engaged. Sometimes one may not be able to get the attention of everybody in the community, but you have to liaise with some key stakeholders like the federal government, state government, Center for Disease Control, these village heads, community leaders like the Meangwas, church leaders. These are people that are respected. The pastors, the imams, the people of the community have regards to them. When there is a pending issue or disease like cholera, you have to educate the people on how to prevent the spread of disease in the community. This prevention is very vital. The awareness should be made in media houses like radio station, television stations, newspapers on cholera outbreak, the way to prevent cholera outbreak, and steps to be taken in the prevention. All these key areas should be highlighted to prevent or to reduce the public morbidity and mortality rates. The steps to be taken in the mobilization. We have 3 steps that can be taken in this mobilization. The steps are in 3 stages. We have stage 1, stage 2, and stage 3. Stage 1 is fact-finding. Stage 2 is planning. And stage 3 is implementation and evaluation. Stage 1, fact-finding. Before the individual goes into community to try to mobilize it for any action, the individual must first collect some relevant information about the community in order not to make a wrong entry. The information may be gotten through informal discussion. Don't introduce yourself in a formal way. You can come into in an informal discussion maybe you go to the village and you engage the youths in the football field in a talk. Explain the reason why you are there. You may visit women in women association gathering and engage them in a discussion. The vital information to be collected include who the community leader or maker is. You have to get this information. Who are the decision makers in the community? The king, the pastors, the imam, the district head, and other stakeholders that are of interest in the community. Who the innovators are and the organization in the community that can influence the community participation, for example, church, mosques, women, organization, voluntary organization, and pressure group. Who are the innovators? The innovators are motivators. They are people that can motivate the community in health promotion and disease prevention. These people include the church, the mosques, voluntary organization, the pressure group like union. We have the road traffic workers, the motor park workers. These people are very important. They were very instrumental in the control of coronavirus. They ensure that people should be spaced in the vehicle. These road workers, in the garage, in the motor park, they were very instrumental. They help in the prevention during travels at the motor park, and from motor park to various destinations. Community traditions and belief that must be taken into consideration in mobilization. What are the traditions that people are having in the community? Some engage in agriculture, but they sell the proteinous part and continue eating carbohydrate. You can educate them on the importance of eating protein. For example, some rare chicken and they see it as a taboo for the children, to eat egg. So they pack the egg and sell. They believe that when the children eat egg, they will be engaged in stealing. So they don't want the children to be eating egg. So by engaging in that tradition, it makes the children to have nutritional disorder or nutritional problem. Statistic of community problems armed with this information and using them to advantage. The mobilizer will be able to penetrate the community. You have to get the information about the community statistic. How many men do we have? How many women do we have? How many children do we have? What drugs do we need to bring in? What quantity of the drugs is very important. The stage 2 is planning stage. This is the stage in which the mobilizer enters the community officially. He should pay a courtesy call to the community leader, visit the king house, and pay a courtesy call to the community leader or decision maker and arrange a meeting with them and his cabinet members. During the meeting, the purpose of the meeting would be explained and inquire about major problems in the community that are amendable to healthcare and how to get rid of them. It is necessary that the leader and the cabinet member see the community problem as real and their solution as is of paramount importance. If not, it will be difficult to mobilize the community to carry out the solution to solve the problem. If they are convinced enough to support the program, then the mobilizer is on the way to success. Don't do the planning alone. You have to engage the stakeholders in the planning. Call their attention because they know where they can meet the women leaders, the youth leaders, the Meangwas, and these people are very key in the mobilization. Stage 3 is the implementation and evaluation. This is the stage of implementation and evaluation of the program. Members of the community are used to implement the plan. Some of the actions that can be undertaken to promote health and prevent disease include cooperative farming to ensure that the community has sufficient food of the right kind. You have to engage them in community farming. For example, Fadama, one project where you make people in a community to group themselves in group of 5 or 6 so that they will all participate in the farming of different types of crops or in the rearing of animals. This grouping will also help you to engage in some advocacy role by calling the attention of government to support the community, to support the group in the tasks that you are giving them. They can insist on acceptable standard of hygiene in and around the homes, in marketplaces, shops, schools, and factories. The environmental sanitation will be agreed upon. Everybody in society must agree on environmental sanitation. The women can help one another to bring up their children in healthy manner and ensure that they are immunized against infectious disease which are prevalent in the community, while the country can afford to provide the community, while the country can afford to provide immunization. Inform the women to bring their children for immunization after delivery, or you can encourage the women to come for immunization during antenatal clinic to prevent disease. They can undertake to fight diseases like malaria and other communicable diseases by organizing insecticide spraying for control of vectors and other carriers of disease like rats, mosquitoes, cockroaches, bedbugs, etc. When you I'll educate the people about the importance of preventing disease, like the use of mosquito-treated net. You call the attention of the government or relevant stakeholders so that they will make this mosquito-treated net available. Also, I'll educate them in keeping the environment free of waterlogged areas, which may be a breeding ground for mosquitoes. Evaluation should be carried out while all these are on, intermittently, to ensure that the set goals are being met. Another school of thought is as follows. Know the community. This includes knowing the villages, district head, local government area. It is very important to have the following knowledge: the geographical setting. For you to make for mobilization to be possible, you have to engage. You have to know the geographical setting of the people. Know the sociocultural, have the sociocultural knowledge, the religion of the people. What religions are they? Uh, are they Christian? Are they Muslim? And are they traditional worshippers? You have to know their religion. So for now, we'll stop at this. We'll look in the next class. We'll look at useful guidelines for public health workers to ensure community participation and involvement. In case you have any question, you can like and write your question in my page. Feel free to ask any question. Thank you.